What are the most commonly abused drugs among teens or young adults?
The most commonly abused substance among young people is alcohol, followed by tobacco. Marijuana inhalants are commonly used, and then other prescription drugs.
What are some of the trends you're seeing in alcohol?
Locally, what we're seeing is young people using alcohol on a regular basis. So we really look at use in two different ways. We look at use for kids who have tried alcohol one time and kind of chalk that up to kind of just trying to get the experience once. As young people might want to just kind of experiment to see what it's like. But what we really want to look at is our 30-day use data, which really shows kids who are regularly drinking. So if kids are reporting that they're drinking, 4 or 5 times in the past 30 days, that kind of speaks to a more regular use of the substance, and that is more concerning.
I've read that marijuana use is increasing, and I'm wondering what the public perception of marijuana as being sort of a safe drug plays into that.
I mean, we're definitely seeing that. We're seeing that locally as well in some of our data, that there's kind of an increase in marijuana use. And I think it's still kind of new to really pinpoint it to one specific thing, but there's been a lot of conversation about the legalization of marijuana in other states and how that's affecting us in the Commonwealth, but also just the perception amongst young people that it is safe. And often the argument that I hear from young kids is, my parents did this in the 60s, this stuff grows in my backyard, when in reality what they are inhaling and ingesting is not just marijuana that is grown in the backyard. Oftentimes it's treated or has other substances in it, and kids don't really understand the risks that are associated with marijuana, and also the misconception that it is not addictive. So kids will tell me that too, marijuana is not addictive, I can quit this whenever I want, when there's some research behind the fact that it does have addictive properties.
And in terms of gateways into other drugs, I would think that probably marijuana and alcohol are among some of the most common.
They are, and cigarettes and nicotine as well.
And in cigarettes and nicotine, that's something in other tobacco products I feel like maybe has decreased in recent years.
It has decreased, and I think that speaks to the advocacy that's been happening, with our young people. This generation of young kids know from birth that cigarettes cause cancer, so that kind of public service is really in place. But nicotine and cigarettes are really one of those gateway drugs. When we start seeing kids kind of engaging in that behavior, using tobacco early, it does speak to a willingness to try new things, and those kids might be more likely to try other things as well. They might be more sensation-seeking kind of kids.
In addition to cigarettes, other forms of tobacco are becoming more common, these small cigars, hookahs. Is there a link between kids who start smoking those and the same type of gateway behavior that you would see with cigarettes?
I think it just speaks to the addictive property that's in it. So nicotine is addictive. So we'll hear oftentimes too with like the vapor cigarettes and things like that, if they're not getting all of the smoke that is, the cancer-causing properties as well, kids have a perception that it's safer. And what's really important to do is to talk about the addictive drug that's part of that. So nicotine is addictive, and all those other chemicals that are in cigarettes cause cancer, or in the hookah, or in the vapor cigarettes. Oftentimes too, we see the younger that kids start using substances, so the more likely they are to try things at a younger age, the more likely they are to have a lifelong addiction or have trouble with those substances. So when we have kids who are experimenting with tobacco at 10, 11, and 12 and become addicted, they are generally more likely to be a lifelong smoker and have all of those negative health outcomes that come along with smoking for years and years. And that is the same for alcohol as well. So the younger, or any substance, the younger the child is when they start initiating use, the more likely it is that they're going to have an addiction or lifelong struggles with that substance. So we really want kids to wait. We really want kids to wait until age 20 or 21 to experiment with alcohol or try alcohol, because we know that their brain is more developed at that point and they'll be less likely to have struggles with addiction with that substance in the future.
And in talking about marijuana, you referred to it, it grows in the yard, and there's other things that are around the house that may be in the medicine cabinet, and talking about prescription drugs and prescription drug abuse among especially teenagers. Is that something that you're seeing a lot of?
It is. A lot of that speaks to availability. So prescription drug use and abuse has definitely been growing. It has been locally as well. Oftentimes that can happen because somebody in a family or a child has been prescribed a substance for, you know, a pain pill or a sleeping pill, and kids can have access to them. So the easier it is for a young person to kind of get their hands on that substance, the more likely it is that they're going to use it. So prescription drugs are, you know, when you're prescribed something, you might be receiving more than you really need, and a kid might kind of hold on to those and save them for later. And oftentimes what we see is kids kind of sharing prescriptions, or, you know, selling prescriptions to each other in schools, in neighborhoods, taking medicine out of medicine cabinets, things like that.